Cardiac output is an important indicator of patient status which cannot be measured by clinical means. It is often difficult to measure cardiac output without invasive techniques, such as thermodilution using pulmonary artery catheters. Although considered a gold standard, thermal dilution catheters often have associated risks which limit their use to critically ill or high-risk surgical patients. Other methods and technologies to non-invasively measure cardiac output have not proven accurate or reliable. In addition, the high cost of these devices has limited their widespread use. The ideal cardiac output monitor is one that is minimally invasive and therefore safe, accurate, reliable, continuous and real-time, inexpensive, and easy to place and use. This video introduces a new concept of endotracheal cardiac output monitoring, or ECOM, that has the potential of fulfilling these requirements. By using the principle of bioimpedance, cardiac output can be measured safely and reliably using a standard endotracheal tube. The ECOM system records voltages produced by a low-frequency current delivered to the tracheal mucosa by electrodes on an endotracheal tube. The proximity of the ascending aorta and trachea allows the design of a device that can optimize the current delivery and signal recording from impedance changes in the ascending aorta. The ECOM system consists of a monitor, cable, and endotracheal tube containing 6 electrodes on the cuff and a source electrode on the shaft. The endotracheal tube is inserted using standard techniques. Once the cuff is inflated, the tube cable is connected to the monitor, and real-time continuous cardiac output as well as other hemodynamic parameters are displayed. The following animation demonstrates the use of the ECOM system and the principles of impedance cardiography. First, the endotracheal tube is inserted using standard techniques. This places the cuff in close proximity to the ascending aorta. A low-voltage, low-frequency field current of 2 milliamps and 100 kilohertz is generated between electrode number 7 on the shaft of the tube and the number 3 electrode on the balloon. 3 orthogonal pairs of sensing electrodes on the cuff are used to measure the change of impedance caused by aortic blood flow. The orthogonal electrode pairs compensate for positional and anatomical differences between the cuff and the aorta. A total of 12 combinations of electrodes can be used for the impedance measurement of flow. If a signal is weak or lost on one channel, the ECOM algorithm can search and select another electrode combination. The result is that the ECOM endotracheal tube does not have to be adjusted once it's positioned in order to obtain usable signals. Impedance cardiography uses the principle of blood conductivity to measure cardiac output. Since blood is a conductor of electricity, as blood flow increases, impedance across the aorta decreases. Conversely, as blood flow decreases, impedance across the aorta increases. A proprietary algorithm is used to calculate stroke volume based upon changes of impedance caused by changes in blood flow. Cardiac output as well as other hemodynamic parameters are derived and displayed on the monitor. The ECOM monitor displays stroke volume, heart rate cardiac index, and systemic vascular resistance. In addition, the ECOM tube detects and displays electrocardiogram waveforms. Animal and human clinical studies have been performed to demonstrate the safety and accuracy of ECOM. A porcine study published in the journal Anesthesiology demonstrated excellent correlation between endotracheal cardiac output monitoring and a transit time flow probe. Clinical studies in humans are now underway at major U.S. and international centers. In summary, ECOM is a promising new technology for the non-invasive measurement of cardiac output using a standard endotracheal tube and bioimpedance. The proximity of the sensors and the ascending aorta provide high signal quality, and the three-dimensional electrode array compensates for variation in tube position and anatomical differences. ECOM may offer the ability to measure cardiac output safely, easily, and cost-effectively in patients in whom the risks of placing a thermodilution catheter is not warranted. Candidates may include patients with cardiac dysfunction, hemodynamic instability, or those in whom large fluid loss or shifts are anticipated. Examples of procedures in which non-invasive cardiac output may be useful include major vascular procedures, chronic hypertensives, and patients with coronary artery disease, thoracic surgery, elderly patients, large orthopedic cases, transplants, and trauma patients.